When we started to look at who we were going to use to provide and start to move that foundation of Microsoft collaboration capabilities into the patient care space, we had a lot of different things that were on our mind, but first and foremost among them is who do we trust with our patients? With Perficient, we really had a great experience and a great relationship and a lot of trust. There's really two big groups of patients that are extremely important for us to understand. And the first patients are the terminally ill. And the second group of patients are the chronically ill. If you put those two groups together, you're looking at anywhere between 35% and 55% of every medical dollar spent in this country is on those two groups of patients. And the fact of the matter is that we can't treat the terminally ill or the chronically ill the same there as every other patient. For the terminally ill, they have extreme needs, and about 80% or more of our patients want to be cared for in their home. And so the setting of care is outside of the four walls of a facility, of a doctor's office or a hospital.
For patients that are receiving palliative care, they have serious illness, they're at the end of life, continuity of care plays a higher role than really just the decision about how for a provider to organize to provide care to patients in the most efficient way possible. And when VITAS partnered with Perficient and Microsoft, we're focusing a solution on that interdisciplinary team. The foundation for our solution is a team's architecture where each interdisciplinary team is a Microsoft team and each patient is a channel. And so in this way, it literally means that patients as a channel are the center of all of our communication and all of our workflows.
We've given all of this entire care coordination team really a modern workplace where they can have a virtual care collaboration experience from wherever they are. But because we provide care wherever the patient lives, that's always been something we've needed to solve for. But Perficient has helped us understand how specifically Power Apps could be leveraged for this, and I think helped us understand how we scale it. It's going to be a tool for all of our clinicians, right? So thousands of nurses and social workers and chaplains and home health aides. And so it has to be something that has high reliability, that we can really rely on as part of that care delivery model. The Perficient team, they have become an extension of our team in a way, and that just makes for a really organic, collaborative experience.
We both organizationally recognize that we're working on something that is bigger than either organization.
Perficient took the time to know who we are. They understood not only the business of hospice and the business of caring for the terminally ill, but they understood our corporate culture. They understood who VITAS was. And when you've got two teams that carry equal passion for innovating healthcare, you've got a killer combo there. We learn from one another. It's been a true collaboration.